After implementing a quality improvement project where residents wore a large tag saying doctor, residents across specialties experienced a decrease in role misidentification during interactions with patients, non-physician team members, and other physicians while wearing this badge. And this decrease in role misidentification was most prominently felt by female residents and those identifying as underrepresented in medicine. My name is Emily Olson. I'm a chief resident in the internal medicine residency program at Mayo Clinic in Rochester. And I have the pleasure of presenting our article entitled Physician Identification Badges, a multi-specialty quality improvement study to address professional misidentification and bias, which will appear in the April 2022 issue of Mayo Clinic Proceedings. And so in our study, we analyzed 159 pre and post surveys from residents in anesthesia, dermatology, internal medicine, neurosurgery, ENT, and neurology at Mayo Clinic Rochester in fall 2019 about their experiences of role misidentification and perceived bias after providing residents with a role identification badge that says doctor in large letters below their typical badge. And so the most significant finding that we saw was that female residents reported a significant decrease in role misidentification, as well as decreased gender bias after implementation of these badges. For example, their role misidentification with patients decreased from about 80% of residents experiencing bias at least weekly down to 18% with patients after the intervention. And similarly, although we did have a small sample size, residents identifying as underrepresented in medicine also experienced that decrease in episodes of misidentification per week with patients, going from about 85% down to 23%. We ended up doing a qualitative analysis of the post-survey free text as well. And in that, residents frequently cited that the badges actually improved the learning environment, and specifically improved their self-confidence and their interactions with patients and team members alike. However, they also emphasized the importance of an institutional commitment to addressing role misidentification, since they were unfairly ostracized for being the only one on the team wearing the badge. And this was especially felt in the operating rooms by our anesthesia residents responding to the survey. Ultimately, our work can really apply to clinical practice as well as what we do for our patients on a daily basis. Patients want to know who's on their medical team, and yet the complexities of healthcare and hospitalizations makes this extremely challenging. So I have had, and I know especially some of my colleagues who are people of color or identify as underrepresented, they've been asked to empty commodes. They've been asked, why can't you give me my pain medicine? Why can't you take out the trash? I have had people like argue with me, like, you're not a doctor. I don't trust what you're saying. Part of what we just ended up discussing is, is some of what residents are experiencing because of their age, because they're still trainees. But regardless, like we want patients to be able to trust their physicians. And so visual aids, such as having doctor in large letters, is extremely beneficial for patients. In our post-feedback survey, as I mentioned, several residents wrote about patient encounters where the badge not only improved role recognition, but was also met with positivity by patients. They shared stories how patients really were embarrassed by not identifying a female physician by doctor, and ultimately expressed gratitude for the large description attached to the badge. I think the biggest thing is that implementing interventions to decrease workplace bias is essential, but it's crucial to involve everybody on the team. And so our work really emphasized the importance of organizational culture in mitigating bias and stereotypes within healthcare. We hope that interventions like delineating roles can improve interactions with patients, as well as positively impact self-perception. And so we found that including everybody in their intervention is the best way to support trainees, especially women and those who are underrepresented in medicine. We hope that our future work can really understand how, as role badges are implemented at an institutional level, how they influence well-being, as well as understand how accurate role recognition plays into institutional culture. And regardless of this, some individuals experience discrimination daily. And so it's going to be an ongoing collaboration to address bias head-on. And we're excited to see what our future work entails.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.